Hello, everybody, and welcome to VETchat. It's great to be back and to have you joining us today. On VETchat, we are always keen to shine a light on topics that can support our veterinary community. And today's topic is such an important one: navigating pregnancy and parenthood in veterinary practice. So I'm delighted to be joined by Dr. Emily Singler today. And for those of you who don't know Emily, let me tell you a little bit about her before we get started. Emily is a 2001 graduate of Penn State University and a 2005 graduate of the University of Pennsylvania School of Veterinary Medicine. Her career in veterinary medicine has included experience in shelter medicine, private practice, and as a relief veterinarian. She currently works as a veterinary writer, a consultant, a mentor, and enjoys writing for both pet owners and veterinary professionals. She is the author of Pregnancy and Postpartum Considerations in Veterinary Teams, and she has spoken both virtually and in person on working in veterinary medicine through pregnancy and beyond. She is also currently working towards becoming a retained certified parental leave coach. Outside of work, Emily is a mum to 4 children, 2 dogs and 1 cat. She enjoys spending time with her husband and her kids, and she loves horseback riding and all things llama and alpaca. She is learning to embrace the chaos of having a big family and find solace in connecting with others and also eating chocolate. So, welcome, Emily. Thank you so much for joining us.
Thank you. Thank you so much for having me. I'm very excited to be here.
So our conversation today, I think it will really resonate with loads of our listeners. So to get started, perhaps could you tell me a little bit about what inspired you to start discussing pregnancy to the veterinary community, please?
Of course. Yeah. So it really stemmed from me wanting to find more answers to my own questions, from wanting to know if, what I was going through was normal, wanting to have some guidance and community for myself around a lot of the decisions that I was making. And I think there's a lot more discussion on those kinds of topics than there was when I was when I had my first child almost 18 years ago. But I wanted to really, I wanted to get a lot of the answers. And then once I started looking into them, then I wanted to share them with other people, because I figured if I wanted this information, if I felt like I was in the dark on a lot of this material, I figured I probably wasn't the only one. And then it just became this passion of mine that I wanted to talk about it. And the more I talk about it, the more I hear that other people are going through similar struggles. And I think that we all feel a lot less alone, a lot less sort of a feeling of not knowing what to do, not knowing if things are going to be okay when we kind of stay in isolation, when we don't talk about it. But when we kind of bring these topics out into the light, we can find a lot more community, and we can find solutions and support each other. So it kind of started small, and it's just grown, and it's been so enriching to me, and I think it has been for other people as well.
Yeah, absolutely. So you said that your eldest is nearly 18, so this all kind of started.
Yeah, she'll be 18 in April. Yeah.
Wow. Has it flown by?
I mean, it has and it hasn't, but yeah, I mean, now I don't know where the time went. I can't believe, that I almost have an adult as a child now. But yeah, I found out I was pregnant with her about 3 months after I graduated from vet school. So I had just started my new job. So I was trying to figure out how to be a veterinarian, and then trying to figure out how to navigate all these other things at the same time. What to do about everything I was experiencing in pregnancy. Should I talk about it? Should I keep it, a secret? All of these things felt very unsure to me, and I didn't know what to do about them. How was I going to work when I had this baby that I was missing all day long? You know, how was I going to handle all the guilt I felt about leaving her? How was I going to find a way to still love my profession that I just spent all this time and money and energy and you know, my whole life dreaming towards having? How was I going to make that all work? So yeah, it's been quite a journey, and I don't I don't have all the answers, but that's, you know, what really inspired me to start really working and researching and just kind of talking to others in the field. So um, yeah, I do feel like in that sense the time has really flown by.
Yeah.
Um,
And how kind of was that time? Because I guess so you just graduated, and then did
yes,
you go straight into practice?
I did. Yeah, I went straight into practice. I was working in a animal shelter. So I was doing a lot of surgery, a lot of um, spaying and neutering surgeries to, you know, sterilize dogs and cats, and caring for, you know, client owned animals in a low cost, high volume setting, and
Yeah.
also caring for animals that had been relinquished into the shelter. So it was very busy, very high energy, fast paced. Um, Always a lot going on. I was definitely trying to prove myself. I was at the phase where I would walk into a room and the client would look at me and say, "Are you the doctor?" Um, and and a lot of clients would ask me, "How old are you? How old are you? Are you old enough to be a doctor?" And so I still very much felt like not many people were taking me seriously in my career. And on top of that, now I thought, okay, well, now my employer's not going to take me seriously because I'm going to tell them that I'm going to need to go on maternity leave, and maybe I'm going to be sick, or maybe I'm going to need to leave work early, or maybe they think I'm not going to come back after I have my baby. And so at that stage in my life, it was very much all about like, I have to prove that I can do this. I have to prove that I can do everything and not let anybody down, and never let my pregnancy or my motherhood or my responsibilities ever get in the way of my work. So I can prove that I'm good enough, I guess, which, looking back on it now, it's unfortunate that I felt that kind of pressure.
Yeah.
But I think when you don't have any other frame of reference, when you don't have anybody to kind of share that with, and when you're getting all this outside pressure that you need to convince other people that you're trying hard enough, that you're a professional, that you're working hard enough, it's
Yeah.
easy to kind of put that pressure on yourself. So it can
Mm.
be a hard time, I think, when you're just starting out, to have to
Yeah.
kind of figure out both of those things at the same time.
How was it when you did tell your boss at the time that you were pregnant?
I was incredibly scared to do it, but I think when I actually did it, my boss was very supportive and was not nearly as shocked or as horrified as I imagined that she might be. Um,
Which is good.
so yes, yeah, I
Yeah.
think I made it a lot worse in my mind than really for any of my pregnancies, working with different managers, uh, bosses, supervisors, that kind of thing, whoever I had to tell. Um, I think it was always worse in my mind than the reception actually was, with maybe one exception. But yes, I particularly during my first pregnancy was met with a lot of support, um, but not a lot of experience in terms of, this is how you make this work. I've done this before. This is what you need to think about. This is what you maybe want to avoid. This is what you might encounter. You know, there wasn't a lot of that. So that part I was kind of left to sort of figure out as I went along.
Yeah. Okay. Oh, thank you for sharing that. And do you
Of
think,
course.
do you have any advice for people who might be, pregnant, might not have told their managers? Yeah, you sort of said that it was a lot worse in your head than how you thought it was going to be in reality. Do you have any sort of advice for
Yeah.
people?
I mean, I would say certainly every situation is different. So I certainly don't want to come across as saying I know exactly what everyone should do, because some employers are not as gracious and understanding as others. I will just share that I had one situation where I was just briefly met with some inappropriate and invasive questioning, basically asked if I had been planning to get pregnant. um, which, unfortunately, I mean, I guess it was probably the least sort of disruptive thing to do. I just answered the question. But looking back, I thought, why did I answer that? Like, why didn't I just call that out as completely inappropriate? But other than that, I had always felt very supported, and I felt like any anxiety that I had, kind of anticipating announcing it was much worse than what the actual experience was. But just kind of in general, what I'll say to other people is that the earlier you let someone who is in a position of responsibility or authority in your workplace know, the sooner you can get support, ideally. In the United States and in the UK and in many other countries, there are specific legal workplace protections that prevent an employer from discriminating, harassing, or allowing an employee to be harassed or discriminated based on their pregnancy or based on their potential to become pregnant, or if they've said that they're trying to get pregnant. All of those things, you cannot be discriminated or harassed for that. You can't be retaliated against, you can't be punished, any of those things. Unfortunately, there are still some employers out there who don't abide by that, or who may not even realize that that's what they're doing. So I know that for some individuals, their concern and their hesitancy is well founded. So for them, I would say, use your best judgment in terms of when you make that announcement and how you do it. But I would say, for hopefully the vast majority of us who will not experience that, if you're trying to think about whether you should wait, there tends to be a lot of pressure to wait until the first trimester is over. Mainly because the idea has historically been wait until the risk of loss, the risk of miscarriage is much lower. With the idea that if something were to happen, if you were to lose the pregnancy, at least nobody would know. But I would counter there, in the unlikely event that were to happen, it can be very important to have the support of those around you, or at least the understanding that you may be going through something that's very challenging. Again, every experience with a loss is different. For some people, it can be very devastating. I experienced a miscarriage during my third pregnancy, and for me, it was extremely devastating. I know for others, their experience may be different, but for me, I felt very glad that others knew ahead of time that I was pregnant, so that when I went through that, I didn't feel like I had to hide what I was going through, because it completely changed my life. At that point, it was something that kind of enveloped everything for me. But even apart from loss, I would say the earlier that you can tell your employer or tell a manager or tell someone who can help take care of you, the better, because that's going to give you all of those protections. That's going to give you their understanding if you have to call out of work more, if you have to come in late, if you need to schedule extra doctor's appointments for whatever reason during your pregnancy. if there are certain tasks and responsibilities, depending on what kind of practice you're in, what your role is in the practice, you may, if you are constantly taking x-rays, or if you're constantly having to restrain practice animals or perform other procedures that are dangerous, like in equine medicine, giving joint injections, that kind of thing. There may be certain tasks and responsibility, the handling of certain drugs that you would like to be able to pass to somebody else.
Yeah.
For your own safety and even just your own peace of mind. So
Mhm.
having someone who knows and can help facilitate that can make a huge difference. And also, if you are having a lot of anxiety about telling someone, just getting it out and getting that over with can be huge for reducing your anxiety and just
Yeah.
helping with your mental health and sort of distress, because we certainly know that can be that can just be a huge negative impact on your quality of life when you're already dealing with so much. So I'm a
Yeah.
big proponent of um, telling your employer earlier rather than later.
Mhm.
But I understand that everybody's situation is unique, and that may not be the right answer for everybody.
Yeah. No, absolutely. That's great. Some really good insights there. Thank you. Because
Oh,
obviously there's the
sure.
whole support aspect, but then also, a very practical health and safety, aspect as
Yes.
well that we've got to
Yeah.
consider, right?
Yeah, there's a lot that goes into it. So I think there are very few things that I talk about where I say there's only one right way to do it, one right answer. I mean, just like in veterinary medicine, there are so many different treatment options for our patients and different practice styles, and different pet owners are gonna be comfortable with different price points and different levels of care. I mean, it's the same for us. Everyone's going to be different. We're all going to have different unique needs and little challenges and things that affect the decisions that we make. But just having the information so that you can make an informed decision. I mean, that's really where I try to focus so that everyone can decide kind of what's best for them.
Mhm. Brilliant. And let's talk a little bit about, what do you think some of the common misconceptions or stigmas around pregnancy in the workplace are?
Well, I mean, I would say specific to veterinary medicine, I think there's just a lot of confusion and uncertainty about what is safe and what is not. Um, and I think for anyone who hasn't been through a pregnancy, it can be, and it's impossible to imagine or try to understand what that's like. And of course, every pregnancy is different.
Mhm.
Um, but in terms of workplace hazards, I did a lot of research on workplace hazards as they affect pregnancy in veterinary medicine for my book. And I learned that some of the risks that we tend to talk about the most, things like radiation exposure, things like inhalant anesthesia exposure, there are actually ways to make them much safer, even for those who don't feel like they can completely avoid them during pregnancy. I will say during all of my pregnancies, I continued to perform surgery. So I did not avoid inhalant anesthesia exposure at all, other than to make it as safe as I possibly could. So a lot of the advances that have been made in equipment, like scavenging equipment that removes most of the waste anesthetic gas from the air that we breathe when we're in the OR, um, that is the single most thing that makes working around anesthesia um, the safest for all of us, including during pregnancy. For those who have to hold animals, restrain animals while taking x-rays, the risk can be made a lot lower just by following all of the principles that were taught from the beginning anyway, in terms of limiting our time in the radiology suite, wearing appropriate protective equipment, really learning about the the x-ray machine itself so that we can try to get the exposure that we want, get the image that we want without having to take as many images. And if we can, using sedation and other types of restraint so that we're not standing right next to the pet or right next to the animal when the x-rays are taken. So I was very encouraged when I learned about that there were safer ways to do some of those things. But there are also some things that we really want to try to avoid. There are certain drugs that can be very dangerous to a pregnancy that we really want to try to avoid handling. Things like prostaglandins and other hormones, they can be absorbed through the skin, and they can potentially lead to pregnancy loss or preterm labor. And then there are some other drugs that can affect sort of the health and development of the growing baby during pregnancy that we need to at least be very careful about.
Just on that point, Emily, what if
Yes.
people are listening and aren't sure what is safe, what isn't safe? Would you have any advice for them, like anywhere to sort of go and ask these sorts of questions?
Yeah, well, I will just put a plug in for my book because I do cover a lot. I do cover a lot of this information that's very specific to veterinary practice in my book. I have 6 chapters on workplace hazards. That's pretty much half the book. Of course, things come up, new medications come out, we learn more information. So there are going to be other really good resources depending on what the topic is, for drug exposure and that kind of thing, mother to baby. I can give you some of these links if you want to
That would
include
be
them for your
Yeah.
listeners. But I think it's called Mother to Baby is another website where you can call and talk to someone and say, this is the medication that I'm taking, or this is what I've been prescribed, or this is what I've been exposed to. What is the risk to my pregnancy? What is the risk during lactation or breastfeeding? So there are a couple sites like that I can give you the links to. For infectious diseases in the United States, the Center for Disease Control, the CDC, has a lot of really good information on their website on infectious diseases and whether there's any known risk to pregnancy or breastfeeding. And I can give you some other links kind of depending on the topic that can give other additional kind of specific information for those particular resources. But I did try to, kind of summarize the most up-to-date and known information at the time that I wrote the book, just for those who want kind of a quick reference, who are working in veterinary practice.
Yeah, that would be fantastic. We can definitely put them on the blog, on the Webinar Vet site.
Yeah.
That would be fab. Thank you.
You're welcome.
So I guess in terms of returning to work after having baby, do you have any sort of tips or any experiences to share around what the challenges can be when returning after having a baby, and anything that employers could do just to be really sort of supportive in the transition back to work?
Yeah, definitely. So again, this is going to be one of those situations where every case is different. Some parents, particularly in the US, where we tend to take much shorter maternity leaves than, at least in terms of what is available in the UK. I know not everybody takes an entire year of maternity leave, but there tends to be more cultural acceptance around that, where here in the US, that is extremely uncommon. So there can be a lot of a sense not feeling ready to go back to work, feeling like you didn't have enough time at home with your child. And so there can be a lot of sadness. There can be some guilt. There can be even sometimes some feelings of, resentment that you're being taken away from your child. But not everybody. Some people can't wait to get back to work. Some people end up going back to work even earlier than they thought, because from a mental health standpoint or from a financial standpoint or whatever the case may be, they feel like they need to be back at work. So again, every case is different, but things that employers can do that can be very helpful, at least to offer Not everybody may want or need these things, but at least to offer. Can there be any kind of gradual reentry where if an employee would normally work full time, if they would work 4 or 5 days a week, can they start out 2 to 3 days a week for a couple of weeks or whatever you decide is appropriate so that they can sort of ease back in? Can they start with shorter days? Can they start their first week kind of in the middle of the week so that that first week is shorter? And for those that have had a longer time out, it can be helpful to do even just kind of a quick re-onboarding process where they have some time to become reacquainted with any changes that have taken place, any new personnel, any new policies, if there's any new equipment or software, anything like that that's being utilized, have some time to kind of round with other staff members to find out what's been going on with some of the chronic cases, any new drugs that are being carried, just have a little bit of time before they're kind of thrown to the wolves, as it were, to kind of get their feet underneath them again, get their bearings, and be able to ask questions before they're kind of back to business as usual. So those things are very common in other industries, in tech industries and sales and kind of the corporate world, for there to be kind of a re-onboarding, for there to be a gradual re-entry program, that kind of thing. And I think that they certainly can be transferable to veterinary medicine. And then of course, for just depending on the circumstance, some parents may need time and space to pump, to express breast milk, particularly if they're coming back, significantly before the year mark. I understand that may not be as common in the UK. If mothers have decided to take a whole year, they may not feel like they need that anymore at that point. But for those who come back and they're still breastfeeding, they'll need time on their schedule. They'll need a designated place that is not a bathroom, that is private, that is outside of the view of staff, employees, animals, anything like that, that is clean. Ideally, it has a place to sit down, a clean surface. It'd be great if it has a sink, and then a refrigerator or somewhere to store their express breast milk. And it can feel very hard for a working parent to step away and say, I'm sorry, I know that we have this extra case. I know that we're really busy, but I'm going to leave or I'm going to go step aside and not see patients for the next 20, 30 minutes so I can pump. So just also having other support in the workplace to say, no, this is important. You need to go do this. We'll be okay. We'll figure things out. We'll get this patient going or do whatever needs to be done. And you take your time. It can be very helpful to have that support, because otherwise it's so easy to say, oh, you know what, we're so busy. I'll skip this pumping session just to help everybody out. So it can be really important to have others who are really also protective of that time for that person.
Absolutely. And even just those little things that you said there as examples, all those little things can make such a difference, can't they, for somebody coming back and returning to work?
Yeah. Just thinking, kind of just to end on that topic of coming back to work. I mean, how nice would it be if your first day back, everybody is aware that you're coming back, everybody is excited to see you. Maybe there's a card or some little treat or something on your desk or your locker or your workstation, and everybody asks how you're doing, and everybody, asks how the baby is and how things go, and they're supportive and they're looking out for you. What a difference that can make versus, you coming back in and them saying, oh, well, thank goodness you're here. Now I'm going to dump all this stuff back on you. All the stuff I've been doing while you've been away and you haven't been doing it. And I've had all this extra work, and, just kind of making you feel bad and making you feel guilty. So just kind of having that framework of, this person needs our support. This person has not been on vacation, and we want them to know how glad we are that they're here.
Absolutely. I think it's we're getting close to time now, Emily, but I think just to end, I think that was a lovely place to end. That would be amazing if we could get to a point where every practice thought like that. It would be amazing, wouldn't it, for all these women returning to work. But are there any other sort of hopes and goals that you hope for the future around continuing this conversation around pregnancy and, family planning in the veterinary field?
Yeah, I have a lot of hopes and goals. Some of the big ones, particularly in the United States, I really would like to see the conversation continue around parental leave. I would like to see parents have access to longer leaves and at least some paid leave. And I think not only in the US, but also in the UK and other countries, we need to do a lot better for fathers and other non-birthing parents. And not only do they need more support, but we need them. We need them to be included. We need them to be part of the conversation. We need them to feel like it's okay and expected for them to ask for time at home, helping to care for their new child, for them to ask for flexible schedules so that they can be involved in child pickup and drop off, for them to be able to call out of work when their child is sick, so that we take some of that burden off of it always being the mother. And that's going to help us equal the playing field. And I think it's going to help fathers have a much more, and other non-birthing parents, feel more involved and more fulfilled as parents. So those are some big wishes, but things I plan to keep talking about and working on.
Brilliant. Oh, well, Emily, thank you so much. I really enjoyed listening to all your insights today.
Thank you.
Really informative. So thank you. And you touched upon your book earlier. Is there somewhere people can go to buy the book if they're interested? Is it available now?
Yes. It is called Pregnancy and Postpartum Considerations for the Veterinary Team. It was published by CRC Press. It is available now. The easiest way to find it is to go to my website, which is my name, EmilySinglerBMD.com. And I have links to purchase it from various sites on my website. And for those who are interested in following me, I'm on Instagram at EmilySinglerBMD as well. So love to have you. I'd like to keep talking about these things and hearing other people's experiences as well.
Amazing. Oh, thank you so much, Emily. We'll put all your links and everything in the show notes as well on the website.
Thank you so much for having me.
Oh, no, thank you. It's been a pleasure. Thanks so much.
Thank you.
Bye.
Bye.